Some of the benefits with a hormonal IUD is, of course, it's very effective at preventing pregnancy, as much as greater than 99%. Hello everyone, my name is Dr. Nicole Sparks and I'm an OBGYN. Today I'm here with In the Know and we are going to be talking about the IUD or intrauterine device. So this is an example of an IUD and there are many different types. You have Mirena, Kyleena, Liletta, Skyla, and the Paragard. So today I'm just going to focus on talking about the Mirena and then we'll talk about the Paragard, which actually doesn't have any hormone in it. This is pretty close to the actual size. It's really small and it's a plastic T-shaped device that we place easily inside of the uterus. Unlike the birth control pill, you can't just get this over the counter at any pharmacy. You actually have to make an appointment with your physician and we will place this in the office, not in the operating room or anything like that. And no, it doesn't matter if you've had children or not, we can still place these safely. These are pretty easy to place in the office. They take about 5 to 10 minutes depending on how easy or how difficult it is to get the device in. It can be a bit uncomfortable. And so we usually will tell you to take some ibuprofen or some pain pills before you come in because you should expect just a fair bit of cramping and bleeding after we place it in the office. So remember, not everyone is going to experience heavy bleeding and heavy cramping, but talk to your physician to see if this IUD is going to be the right choice for you. Depending on which IUD you get, they last from about 3 years to 10 years. The Mirena, which is a common one, lasts about 5 years. The Paragard, which is non-hormonal, lasts 10 years. Now, if you want your IUD removed, it's pretty simple to remove in the office. Basically, as long as we can see the strings, we can go and pull them and it usually will come right out. Some of the benefits with a hormonal IUD is, of course, it's very effective at preventing pregnancy, as much as greater than 99%, because we don't have to rely on someone to take it every day. It's just there and releases a little bit of hormone just locally every day. Also, if you're somebody who tends to have heavy periods, the IUD can make your period significantly lighter, especially the longer that you have it in. There are some downsides. Usually when we first place it, there is a fair amount of irregular spotting, which some people don't like. But the same as for the birth control pill, the longer you have it in, the less that's likely to bother you. And some people actually end up having no periods, or what we call amenorrhea. Some people may have pelvic pain, and in some people, the IUD may not stay in. That's only with a very small amount of people. Most people who we place this in will actually do very well. So this is the Paragard IUD, and the reason why it's different from all of the other IUDs is that this does not actually contain any hormone. So any patient we have, say they have like an active cancer or something like that, or they simply don't want any hormones, then this is a great device for them. So you'll notice that it's actually surrounded by a copper wire, and that actually makes the environment not so friendly to sperm. Okay, so if sperm can't really maintain in that environment, then that will keep you from getting pregnant. The Paragard IUD can last as long as 10 years. So if someone really wants a very long-acting form of contraception, then the Paragard IUD is a very, very good choice. Some of the downsides, however, is that some users may notice some increase in heavy bleeding. So if you already have heavy periods, I actually would not recommend the non-hormonal IUD. I would recommend one of the hormonal ones so that you don't make your periods any heavier than they already are. We advise our patients that when you remove the IUD, your fertility goes right back to what it was when you didn't have the IUD in place. Now remember, all of the information provided here is for your medical purposes and information only. If you have specific symptoms or complaints, make sure that you actually talk to your physician so they can figure out the form of contraception is right for you. Thanks for watching today. I hope you guys learned something.